Fortunately, our generation have an opportunity to enjoy a beautiful green planet. We are not sure how many generations ahead of us will have this opportunity though. But how many of us today show little gratitude by keeping our environment safe and healthy? Our daily survival depends on nature, such as water, air, planet, and animal. So we all have a duty to ensure long-term sustainability of this natural gift for our future generation. In this video, I will briefly introduce the concept of urban green space and its effect on human health. The purpose of the video is to introduce a new idea, which is green space at healthcare ground. So, what is green space? In general, green space includes any natural environment such as park, community garden, urban street plants, front and backyard of a private property, green roof, green wall, etc. Urban green spaces usually located within or near to urban areas. What are the main concerns? We are losing green spaces due to increasing urbanization, population density, and increased demand for human-built environment. These factors are continuously putting pressure to replace natural environment into human-built environment by cutting trees and deforesting. Evidence suggested that incorporating green space within or near to the urban areas are positively associated with physical and mental health of urban dwellers. Urban green spaces not only enhance natural beauty but also provides natural shades, purify air, and mitigate effects of natural disaster such as flooding and heat island effect. It also enhances utilization of human-built environment by city dwellers and contributes to the concept of active living. Worldwide, many cities have successfully incorporated green spaces into the urban environment. But there are new ideas or innovative concepts are arising on this issue. One of these ideas is the healthcare green space. Healthcare green space means incorporating diverse green spaces at different kind of healthcare setting. Whenever we think about healthcare ground, we can visualize ambulance, helicopter landing site, paramedics, and patient waiting on a wheelchair, parking lots, and often vast land around the premise without any purposeful use. Hospital and healthcare ground can be utilized by enhancing various kinds of green spaces. These are recreational park, natural spaces, garden, green wall, or green roof. One study has shown that patients who can view nature through their windows recover quicker than the patient who don't have this opportunity. Why hospital-associated green spaces are beneficial to health? Let's discuss some of the benefits of green spaces in healthcare ground. Green spaces can be used for walking with patient or as a therapeutic ground for the patient. It can act as a recreational ground such as photography, observing natural beauty, bird watching, and various other participatory activities which are sort of an escape for the patient, healthcare workers, and family members from hospital clinical environment. It will enhance accessibility of green space by the patients or residents with chronic disabilities. Green space can increase job satisfaction for healthcare workers by providing a refreshing and enjoyable short periodic break within or between long shifts of duty. Green space provides a respite for family members of a patient and visitors to relieve their stress for a little while. Care providers are happy to bring their ill relatives in contact with nature, thereby reduce their stress significantly as well. Community members can participate at various health promotion activities such as participation in health fair or community gardening in healthcare associated green spaces. Participatory activities provide an opportunity for increasing their community network and strengthen the network. Eventually, the healthcare authorities can disseminate health-related news to the community member by organizing various health promotion events. Healthcare authorities can prove to community members that they are advocating for healthy and active living by converting unused hospital ground into green space and allowing community members to participate at various health promotion events. Study also shows that association between green space and better health is likely stronger for disadvantaged population. By applying this rationale, we can also say hospital patients and residents of nursing homes who are vulnerable population with various age distribution and with various forms of disabilities will definitely be benefited from healthcare associated green spaces. Some critics may say green spaces are associated with vector-borne disease, seasonal allergy, and ultraviolet ray exposure. These challenges are preventable by following prevention guidelines such as wearing insecticide or sunscreen, avoiding dawn and dusk. The significant health benefit and environmental benefit that provided by green spaces are always outweighing few small disadvantages of hospital-associated green space. For adequate support from key stakeholders such as scientists, healthcare authorities, environmental activists, public health unit, Ministry of Health, policymakers, and various levels of government are vital to initiating and maintaining the sustainability of healthcare-associated green space project. Finally, do we have any role as an individual? Yes, we do. Our individual level fight to save environment and little effort to add new green space to the world has the cumulative effect to save our green planet for future generations. Each of us can act as a catalyst to promote healthy environment and healthy attitude to our environment. So let's promise to plant a tree today and be a generous contributor to the community green space, and let's others to follow through it. Thank you.